Good afternoon. Hi, Dr. Caprano. Thank you for joining us today. Dr. Luisa Caprano is a maternal fetal medicine specialist, and she's going to help answer some questions. September, we're highlighting the women's services at Baptist Health System. Let's start with the first question, very basic, but what is maternal fetal medicine?
Good morning, and thank you for having me. A maternal fetal medicine specialist is also called a perinatologist. We undergo a traditional training in obstetrics and gynecology residency with an additional 3 years of training in how to treat maternal medical complications related to pregnancy. Additionally, the maternal fetal medicine specialist has extended training in assessment and treatment of fetal problems.
What are the risk factors for a high-risk pregnancy?
So patients may be referred to the maternal fetal medicine specialist if they have a pre-existing medical condition prior to pregnancy, develop a medical condition during pregnancy, at the time of delivery of their baby, or at times during the postpartum period, if that pregnancy-related complications do continue. In addition, patients will see an MFM or a maternal fetal medicine specialist during pregnancy if their baby has a structural abnormality.
Does someone with a high-risk pregnancy need special tests?
So high-risk moms will have more visits to the doctor. They may have more ultrasound or sonogram studies to make sure their baby is growing well. The visits would entail frequent blood pressure checks. Urine will be tested to look for protein, which could be a sign of preeclampsia, and urinary tract infections. Also tests for genetics or other problems may be done, especially in moms who are 35 years or older, or with history of genetic problems in past pregnancy. Often, these patients may require medicine for their medical diagnosis, like with diabetes, asthma, or for high blood pressure.
Does someone who is considered high-risk pregnancy need to be aware of certain signs or symptoms? I know you mentioned urinary tract infections.
Mm-hmm.
Are there others?
So like with any pregnant women, high-risk pregnant moms need to watch for any signs of problems. For instance, if you pass out or have a seizure, if you have severe vaginal bleeding or severe pain in your lower pelvis or on your belly, if you have a gush of fluid or leakage from your vagina, if you haven't felt your baby move as you would usually do on a daily basis, any of this or other symptoms that occur, you need to get care quickly and tell your doctor what you're experiencing so they can go ahead and evaluate you properly.
What steps can I take to keep myself at lower risk and maintain my health and the health of my baby?
So most importantly, go to all your visits, all your doctor's visits, and that will ensure that you do not miss any tests to catch any new problems. Eat a healthy diet that includes protein, milk and milk products, fruits and vegetables. Take any medicine that are prescribed to you, including iron or vitamins. Take folic acid daily. Folic acid should be started before and during early pregnancy, and that will help reduce chances for your baby to have certain birth defects. Follow your doctor's instructions for activity if you can work or exercise. Do not smoke, drink alcoholic beverage, or use recreational drugs. If you need help quitting, talk to your doctor about programs and medicines. And most importantly, stay away from people who have colds and other infections.
Okay. What happens at your first maternal fetal appointment?
So when you first come to visit us, we will go over your personal, medical, surgical, obstetrical, and gynecologic history. We also are going to interview you about any potential disease exposure. We will ask you about medication that you have been taking in the recent past and at present, and also health conditions that may run in your or your partner's family. We are also going to get a set of blood and urine tests. The genetic counselors who work with us may need to visit with you to explain various risk factors in your pregnancy and may recommend past and may recommend certain genetic tests for you and your baby. Also, your baby will be evaluated in your womb by ultrasound or sonogram. And sometimes the maternal fetal medicine specialist would like to meet with you before you get pregnant to outline the best possible care for you in your pregnancy. That type of visit is called preconceptional counseling.
Do maternal fetal medicine doctors deliver babies, or do I need an OB and a maternal fetal medicine specialist too?
So most often, maternal fetal medicine docs do not deliver babies. That is why it's so important to keep your appointments with both your OB doctor and your high risk or MFM doctor.
Okay. There are women who are nervous to come in and deliver their babies during COVID-19. Can you share some of the safety protocols in place at the Baptist Health System?
We are prepared and ready for our expecting moms. We have protocol in place to ensure women have safe deliveries during this pandemic. Like for instance, we have one designated person with the moms during their labor and delivery process. Our patients are screened for flu-like and coronavirus symptoms before entering the labor and delivery unit. All mothers admitted to labor and delivery are tested for COVID-19. If you are in labor or need obstetrical help and you test positive for COVID-19, our medical staff admits you into the unit and takes measures to prevent the spread of the virus. For instance, wearing personal protective equipment and ensuring full sanitation and disinfection of the area.
How has COVID impacted what you do? Do patients have access to telehealth visits to help them maintain a healthy pregnancy during this time?
So some of the outpatient and inpatient measures that we have implemented are 100% screening protocols prior to the visit and at the time of the visit, wearing personal protective equipment or PPE, minimizing or bundling in the in-person visits when both maternal and fetal evaluation is necessary. We are using telemedicine and electronic services for all high-risk OB visits and follow-ups, which can be safely performed by those means. We also have in our clinics rooms designated exclusively for COVID-positive pregnant patients who are completely sanitized and disinfected at the end of every visit, and the staff is appropriately equipped and donned to avoid spread of the virus.
May I ask you, how important is it for moms to have access to a dedicated OB emergency department like at the Baptist Health System?
It is extremely important. I cannot overemphasize the importance of our pregnant moms, both high risk and low risk alike, to have access to a fully dedicated OB emergency department. Our OBDs have experienced staff who is trained and has regular training in obstetrics and gynecology. Providers alike in the field of pregnancy, both low risk and high risk. It is the only way we can ensure excellent, consistent, efficient, and effective care of our pregnant patients and their babies to our community to get the excellent outcomes that we get.
Baptist Health System is now the only healthcare system in San Antonio and South Texas who has 2 facilities with NICU Level 4 designations, one at North Central and at St. Luke's Baptist. What does that mean for families who need specialized care from a NICU?
We are very proud of our accomplishments. What that means to us as a community, it means peace of mind. It means keeping families close to their homes, to their loved ones during such an important time in their life, like the birth of their babies, and having the care that our patients truly deserve right here at home in San Antonio.
Thank you so much for your time today, Dr. Caprano. We appreciate you.
You are very welcome.